Good evening, everyone. Thank you for joining me tonight. And my name is Jonathan Adam Ward, and I'm an RN, and I'm currently enrolled in the BSN program at McKendree University. And tonight I'm going to be presenting a presentation regarding heart disease. And our purpose this evening is to identify a vulnerable population of people and understand three key factors affecting cardiac health, that as well as signs and symptoms of a heart attack. Tonight there are three objectives for this presentation. The first one is, after viewing heart disease prevention presentation, that 80% of the adults that are present will be able to identify three ways to reduce their risk for heart disease by written exam. The second objective is, after viewing the heart disease prevention presentation, 80% of adults will be able to identify three heart healthy food groups that can reduce their risk for heart disease by written exam. And the third objective is, after viewing heart disease prevention presentation, 80% of the adults in the audience will be able to identify three appropriate forms of exercise that can reduce their risk for heart disease by written exam. So, heart disease. Each year, roughly 790,000 Americans suffer a heart attack, and 1 in 7 deaths, which continues to be caused by heart disease. It's the nation's leading killer. County Health Rankings and Roadmaps. This is an organization that is ran by Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. They do it collaboratively. So they believe that America can become a nation where getting healthy, staying healthy, and making sure our children are growing up in a healthy environment. That's really their top priorities. They also have a vision of an America where we can all strive together to build a national culture of health that enables all in our diverse society to lead healthy lives now and for generations to come. As we see here for our data, this is actually the Williamson County, Illinois data, and three major health factors that contribute to heart disease is smoking, obesity, and the lack of physical activity. Well, we see that the population in 2017 in Williamson County, 16% of residents smoke, 32% are obese, as well as 26% physically inactive. It's very interesting data, and truthfully, the Williamson County data is statistically higher than the state average. Healthy People 2020, they are actually operated by the U.S. Department of Human Health and Services, and they evaluate the health of a particular population. They identify risk factors and create goals to improve population health. Well, concerning heart disease, Healthy People 2020 created three goals to improve health. The first goal is to reduce illness, disability, and death related to tobacco use and secondhand smoke exposure. Their second goal is the consumption of healthful diets and achievement and maintenance of healthy body weights. And the third goal is to improve health, fitness, and quality of life through daily physical activity. So there's four key factors that influence your cardiac health. You have smoking cessation, the promotion of health through healthy diets, improving health through physical activity, and knowing signs and symptoms of a heart attack. So we're going to look at smoking cessation, the adverse effects of smoking. First, it robs you of some of your good cholesterol. By attacking your good cholesterol, it also increases the bad cholesterol in your body, which can lead to coronary artery disease. Smoking temporarily raises your blood pressure. Hypertension also is another factor that leads to coronary artery disease. Smoking increases the blood's clotting likelihood. So for a heart attack or stroke, that's one way that they both occur, is because of clots. They make it an obstruction in the vessels and impede the blood flow to the heart or to the brain. Smoking also makes it more difficult to exercise because your lungs aren't able to inhale and exhale properly, And so it's definitely a barrier. So you may already be thinking, what good would it do for me to quit smoking now? Because maybe you already have coronary artery disease. But don't be discouraged. Your lungs can begin to heal themselves as soon as you stop smoking. Heart disease can be prevented and controlled, but you must follow a treatment plan. And I encourage you to consult your primary care physician for that treatment plan, but quitting smoking should be a big part of that. It's never too late to quit smoking. So choose a date within the next 7 days and say, this is the day that I'm going to quit smoking. Maybe sign a contract, a no smoking contract in front of witnesses, just to help keep you accountable to that no smoking date. You can use the time until your quit smoking day as ways to cut down gradually from the number of cigarettes that you smoke each day. So there's really 6 ways that you can quit smoking, and really cold turkey is one of them. You just say, this is the day I'm going to stop, and you put them down, you throw them away, you get rid of them and say, I'm done. But that really doesn't work for everyone. Not everybody can just quit cold turkey. So maybe you can try reducing the number of cigarettes that you smoke each day until you completely stop smoking. So if you smoke 20 cigarettes a day, then maybe cut down to 10, and then a few days later, a week later, cut down to 5 a day. And before you know it, you'll be able to quit successfully. Maybe try only smoking part of a cigarette. So let's say you inhale or you have 15 puffs on a cigarette. Maybe you only take 7 or 8 puffs instead of the full 15 that you normally do. So that helps decrease your exposure. Medication therapy. That's another way that you can help with smoking cessation, and consult your primary care physician for that prescription and what medication might be best for you. Really, that medication is designed just to help through breakthrough cravings. So that way, if you get that urge, it's kind of in your system to help you overcome that temptation. You'll see that I gave you a handout, actually. Plan your quit day. It's by the American Heart Association. And really, it's just a contract of saying, you know what, this is the day I'm going to quit smoking. And here's a couple people that are going to help me on this journey and hold me accountable. So what are some benefits of smoking cessation? Well, in your first 20 minutes after quit smoking, your blood pressure and your heart rate recover from the spike that's induced from the cigarettes. After 12 hours of smoke-free living, the carbon monoxide levels actually go back to normal in your body. After 2 to 3 weeks to 2 to 3 months of smoke-free living, your circulation in your lungs function begin to improve. And after 1 to 9 months of smoke-free living, clear and deeper breathing gradually returns as coughing and shortness of breath diminish, and your lungs actually regain the ability to have a productive cough, which is very healthy instead of hacking, so to speak. It's actually a lot easier on your body, and this enables your body to have a reduced risk for infection as well. After 1 year of quitting smoking, a person's excess risk of coronary heart disease is reduced by 50%. That's pretty marginal. After 5 years of smoking cessation, your risk for cervical cancer, or cancer of the mouth, cancer of the throat, your esophagus, bladder are cut in half. Your risk for cervical cancer and stroke actually return to normal. After 10 years, you are half as likely to die from lung cancer. Your risk for larynx or pancreatic cancer decreases. And this is a kind of an astonishing statistic here. After 15 years, your risk for coronary heart disease is the same as a non-smoker. So let's take a look at the promotion of health through healthy diet. A healthy diet and lifestyle really are your best weapons to fight against cardiovascular disease. It may seem like a mountain, so to speak, but really it's something that's not that hard. It's very obtainable to have a healthy diet. So remember, it's your overall pattern of your choices that counts. So you start making simple steps, slow steps towards eating right, and each time you make a good decision, that's adding to your health. Those simple steps actually you can see in the long run of long-term benefit of your health. So a way you can start is by knowing how much calories you consume each day. Typically food labels are on a 2,000 calorie based diet. You may need fewer calories or more calories depending on several factors such as age, gender, and level of physical activity. So I would encourage you to talk with your primary care physician what an appropriate daily amount of calories would be a good intake for you. If you're not trying to gain weight, then don't consume more calories than you spend in a day, because that's actually how you gain weight, is those calories just stick around and they have to go somewhere, so they go on you. You may be eating plenty of food, but your body may not be getting the nutrients it needs to be healthy. So nutrient-rich foods have minerals, proteins, whole grains, and other nutrients, but are lower in calories, which is very important, because this can help you control your weight, your cholesterol, and your blood pressure. So, eat an overall healthy diet pattern that emphasizes a variety of fruits and vegetables, whole grains, low-fat dairy products, skinless poultry and fish, nuts and legumes, and non-tropical vegetable oils. So limit saturated fats, trans fats, sodium, red meats, sweets or sweetened beverages. Because if you choose those, they can really actually attack your cardiovascular system and really lead to an increased risk for heart disease. So if you choose to eat red meat, then compare labels and get a lean cut of meat. So replacing saturated fat with healthier fat could lower your cardiovascular risks. One of the diets that actually fits this pattern of eating is the DASH diet. It's the dietary approaches to stop hypertension. And if you take a note at your handout, it goes through all the food groups to what you should consume on a daily basis. So the first food group is grains and grain products. The American Heart Association actually recommends that you have 7 to 8 servings of grains and grain products a day. So they may come in the form of a slice of bread or cereal, cooked rice, pasta. Next we have vegetables. We are to consume 4 to 5 servings of vegetables a day. It may be a raw leafy vegetable, a half cup cooked vegetables, or 6 ounces of vegetable juice. Fruits, 4 to 5 servings of fruit a day. They can come, in a medium-sized fruit is a serving size, a 1/4 cup of dried fruit, a half a cup of fresh fruit, or 6 ounces of fruit juice. We should consume 2 to 3 servings of low-fat or fat-free dairy foods. So an 8-ounce glass of skim milk, or a cup of yogurt, or 1.5 ounces of cheese. Lean meats. We should only consume 2 servings of lean meat a day or fewer. So our portion size is not really the 24-ounce T-bone at your local steakhouse, but 3 ounces of meat after it's been cooked, of whether that's beef or whether that's skinless poultry or fish. Nuts. You should actually, nuts, seeds, and dry beans, you should only have 4 to 5 servings actually per week of that, because they can be very high in fats, and it's a good source of good fats, but you also have to make sure you're not consuming too many of those. So a serving size would be 1/3 of a cup, or 1.5 ounces of nuts, maybe a tablespoon or a 1/2 ounce of seeds, or a 1/2 cup of cooked dry beans. Fats and oils, you should only have 2 to 3 servings of those per day. And the serving size for that would be a teaspoon of soft margarine, maybe a teaspoon of low-fat mayonnaise, a tablespoon, 2 tablespoons of light salad dressing, or 1 teaspoon of vegetable oils. So sweets, that's a big one. Most people love sweets, so how much should we consume? No more than 5 servings per week we should have sweets. So what is a serving of sweets? Maybe a tablespoon of sugar, a tablespoon of jelly or jam, a 1/2 ounce of jelly beans, or maybe an 8-ounce lemonade. If you'll take note of the next handout I have for you, it's ways to cut out added sugars by the American Heart Association. And they say that women should only consume 6 teaspoons of sugar on a daily basis, which is about 100 calories. Men, we get a little bit more. We get 9 teaspoons per day. with no more than 150 calories. So where do added sugars come from? Maybe soda or sweetened beverages. Unhealthy breakfast cereals have a lot of sugar. Syrups, ice cream, unfortunately. And of course baking goods, cookies and such have a lot of added sugar. So what are some ways that you can avoid them? Check the nutrition labels, educate yourself, make sure you're reading what you're eating. Limit sweet and sugary beverages, so water, unsweetened tea, plain coffee, black, no sugar, no cream, anything like that. That's also a good alternative. Choose simple foods over heavily processed foods, especially in cans. And if you're eating canned fruit, make sure you rinse them because that'll help take some of that added sugar away. So limit foods and beverages high in calories and low in nutrition. And make sure to limit your saturated fats, your trans fats, and the sodium that you have in your diet. So I'm going to show a video for you at this time. And this is actually by the American Heart Association. And really it talks about color in your diet and how beneficial that is to your health.
Color is power. It heals, defends, soothes. Color energizes in the morning and revives throughout the day. It's bright green, deep red, orange. Not artificial orange, orange. Color like this helps you do more, play more, and live more. And when you add a serving of color to your plate, you may get a healthier, longer life in return. Life is why. Color is how. Add color.
So color. I give you a handout of the American Heart Association.
Starts out with beets, you notice that? No way.
I probably don't eat anything on here. Oh, maybe a little.
Sorry for the technical difficulty.
Don't worry about it. I eat just about everything on here. But the thing is, I mean everything.
At one time?
Yeah. Food is fuel to me.
Now I know the reason why we have fruits and vegetables instead of steak.
So color. Color is very important to your diet. And so the colors the American Heart Association recommends is red and pink. Vegetables or fruit, that includes red apples, red grapes, red peppers, red potatoes, rhubarb, strawberries, tomatoes. And on your handout, they list a lot more than that, which I've selected here. You have the color green, such as broccoli or pears, limes, romaine lettuce, peas, kale, celery, kiwi. Blue and purple food groups, so such as blackberries or blueberries, dates, eggplants, grapes, plums, raisins. You have yellow and orange colors, so acorn squash, cantaloupes, carrots, grapefruits, oranges, pineapples, sweet potatoes. You have the white and brown colors, so bananas, cauliflower, garlic, Jerusalem artichokes, onions, or potatoes. So improving your health through physical activity. Being physically active is an important to prevent heart disease. So as far as the recommendations for how much exercise or physical activity we should do on a daily basis or within a week, American Heart Association has some of those guidelines for us. We should have at least 150 minutes per week of moderate exercise, or 75 minutes per week of vigorous exercise, or you can have a combination of the moderate and vigorous as well. You should have 30 minutes a day of exercise 5 times per week. So, for people who could benefit from lowering their blood pressure or their cholesterol, we recommend 40 minutes of aerobic exercise of moderate to vigorous intensity 3 to 4 times a week to lower the risk for heart disease. So you may think, you know what, I can't do 30 or 40 minutes each day or 4 or 5 days a week. That's okay, just start somewhere. So that may only be 10 minutes or 15 minutes, because what you can do is actually work up to your goal of maybe that 30 or 40 minutes. So don't think that you just have to do 30 or 40 minutes or do nothing at all, because really, even if you do a little bit, that helps you in the long run. So don't let the all or nothing thinking rob yourself of the benefits of exercise on a daily basis. Physical activity. Physical activity is anything that actually makes you move your body and burn calories. So they include things such as climbing stairs, playing sports, walking, jogging, swimming, or biking. So it doesn't have just to be walking or just have to be a treadmill. There's definitely other options to be able to get your exercise in. So the simplest form of exercise can improve your heart health greatly. And for stamina and flexibility, strength and stretching are also great exercises for that. So a walking program is very beneficial for you for a couple of reasons. It's free. You can do it pretty much anywhere. There can be a social component if you walk with other people, and it's a really just a great exercise for you. Walking can be very easy and can be very satisfying to you and your health. So let's talk about signs and symptoms of a heart attack. So what is a heart attack? A heart attack occurs when the blood flow that brings oxygen to the heart muscle is severely reduced or stopped. This actually happens because coronary arteries that supply the heart with blood can slowly become thicker and harder from a buildup of fat, cholesterol, and other substances called plaque. This slow process is known as atherosclerosis, and this is where the plaque, if the plaque that breaks open and blood clot forms, then that's where the obstruction comes in and to your heart and can cause a heart attack. So there's a handout from the American Heart Association that I gave you that are the common warning signs and common warning signs of a heart attack. So if you experience any of those symptoms, please don't wait. Seek medical attention immediately. Although some heart attacks can come on very sudden, a lot of them occur very slowly with mild pain or discomfort. So pay attention to your body and call 911. So some of those symptoms of a heart attack can include chest discomfort. Again, this can be in the center of your chest, or it can kind of be on the side, or it can actually even be in your back. It can be an uncomfortable pressure feeling or squeezing, or a sense of fullness or pain. Other areas of discomfort can be in your body, such as of your arm. Some people experience arm pain. Shortness of breath, with or without chest discomfort. If you have shortness of breath for not a known reason, then there may be something going on that you need to be thinking, hey, could I be having a heart attack right now? Because I should not be short of breath. Other symptoms may include breaking out, just a sweat, lightheaded, or getting nauseous. Now, there's a myth that heart disease is a guy thing. Well, the truth or the reality of the matter is that it's the leading cause of death in women over the age of 65, and it kills 5 times as many women as breast cancer. So as women, they can experience the same symptoms as a man, which is I have displayed for you, but there's also some other symptoms that women can have that they think, I'm not going to really be having a heart attack, such as nausea or vomiting. They can have back pain or have jaw pain, and so it can be atypical symptoms or things that we don't think about, the crushing chest pain and the arm pain, when in reality women can experience those other symptoms. So if you take your antacids or your indigestion medicine and you're like, this isn't going away, you need to go to the hospital because you may be having a heart attack. So learn the signs of a heart attack. Even if you're not sure if it's a heart attack, have it checked out because minutes matter. So in summary, it's never too late to quit smoking. It's never too late to quit smoking. It doesn't matter how long you smoke, it doesn't matter how old you are, quitting smoking will be very beneficial to your health. A healthy diet and lifestyle are your best weapons to fight cardiovascular disease. So it's not a bunch of treatment, or it's not a bunch of fancy diet plans or anything. Just a healthy diet and a healthy lifestyle are great weapons to fight cardiovascular disease. Being physically active is important to prevent heart disease. So it's better to go and walk 15-20 minutes than to lay on the couch for 15-20 minutes. So make sure that you're not being physically inactive, but physically active, because it will really benefit your long-term health. And call 911 immediately if you experience any signs or symptoms of a heart attack. So the way we treat ourselves in the early part of our lives strongly impacts how functional we're going to be when we are in our 80s and when we're in our 90s. But it's never too late to make those changes. So remember, it doesn't matter how old you are. Make the changes now, and you'll see the benefits in the long run. Are there any questions?
Just that they didn't say, why didn't they say anything about the numbness or tingling in the fingers on your left hand?
Yeah, you can experience numbness or tingling actually in either hand, but that was not one of the major ones that American Heart put out there as far as for the signs and symptoms. But that is one of the signs and symptoms. So the ones that I covered were not the only signs and symptoms, but the most common ones. Any other questions? All right, so here are my references. Well, thank you all for coming this evening, and I hope that this information is able to impact your life for the better of your health, but also have an impact on your heart. Thank you.
I like the idea.